Hey everyone, Dr. Nicola Ducharme here. So May is Lyme Disease Awareness Month. So I am going to be doing a couple of videos on topics related to Lyme disease over the next couple of weeks while we have the rest of this month. Today I want to talk about testing for Lyme, which is always a bit of a sort of iffy topic, and the difference between doing blood testing and doing urine testing, because I know there is some sort of newer tests out now. So I just wanted to share a little bit of information on what I am choosing to do for testing. So traditionally, all Lyme testing has been blood testing. However, I will say that if you test through a lab like LabCorp or Quest or like one of the big commercial labs, the testing is not going to be as sensitive. And this is one of the massive problems we've had over the years in the diagnosis of Lyme, is people who've had inadequate testing in the beginning. And so Lyme has been ruled out based on either a negative test or even worse, a positive test with a primary care doc or an infectious disease doc just saying, oh, that was a false positive, you don't have Lyme. So by the time people come to see a Lyme literate doctor, they've usually been tested, like probably 8 times out of 10, and it's either come back negative or it may have even come back positive and it was just swept under the rug. So going back to the LabCorp and Quest, and I'm not singling them out. There are zillions of tests that they do great. I'm not trying to be overly critical, but let's be realistic. To get an accurate diagnosis, you have to have the best testing positive. So if an ELISA comes out positive on LabCorp, Quest, big commercial lab, whatever the case may be, then to me, that's clinically significant. We don't then say, oh, that's a false positive and just sweep it under the rug like it's nothing. However, a negative ELISA test is not nearly a good enough test to rule out Lyme disease. Okay, so even testing through insurance, through the bigger labs, and I do know some Lyme literate doctors who still do that. Obviously, the private labs get very expensive for testing. Even if we go through that lab and the ELISA is the only test done, that is not adequate. Like there has to be a Western blot done. Now, sometimes a doctor will say ELISA, and they'll only run a Western blot test if the ELISA was positive, which again is just setting people up for failure in finding the right information. So step one is whether you've had testing through a lab that wasn't a Lyme specialty lab, whether it was negative or positive, don't give up. Don't let that be your definitive answer, because I guarantee you it's not sensitive enough to really tell you yes or no for sure. Okay, so the next thing I do is look to a Lyme specialty lab. And I have used IGeneX for years and years. They're pretty much gold standard in the industry. There are some other labs like MDL also does fantastic Lyme testing. There are some labs abroad like Almond Labs. But the way I was trained with the mentors I have and being here in California, I got into IGeneX testing and I've been very, very happy with them over the years. So a lot of the testing done is blood testing. And I want to just try and define something without getting confusing about it. When we test for an infection, there are 2 ways to test. The first is we look at the immune system's response to that infection. And the second way is we look for the bugs themselves. Okay, so in very general terms, the immune tests are called indirect tests, and looking for the bugs are called direct tests. And there's a few variations and a few options within that. When I start working with someone who doesn't have a diagnosis yet, or maybe has had a positive ELISA or a couple of bands positive in a LabCorp test, or no co-infection testing, even if Lyme testing is being done, I will look to do an IGeneX panel. And typically, I will run a panel that includes Borrelia burgdorferi, which is like your classic textbook Lyme bacteria, the strains that cause tick-borne relapsing fever, and IGeneX has just added that in the last year or so, and I find it to be very helpful. And I will look for antibody tests to the different co-infections. And I will also look for what's called a FISH test for the different co-infections. And right now, Babesia and Bartonella, we can do FISH tests. So in IGeneX language, I like the tick-borne disease panel number 4. I think gives a fairly good kind of, broad representation of the different co-infections and more of the immune antibody tests. Over the years, I used to do more PCR testing. PCR testing means they're actually looking for the DNA of the bacteria or the pathogen in whatever sample it is, the blood sample, the urine sample. PCR is more of a direct test. It's looking for the bug. It's not looking for an immune reaction to the bug. Now, to be fair and granted, there is no one Lyme test that's 100% sensitive, that's 100% specific. I mean, Lyme testing is sort of slightly inherently flawed just by nature of the beast. Like, it burrows into the tissues, it doesn't stay in the bloodstream, it suppresses the immune system. So if you're measuring an immune response, we're measuring an immune response to a bacteria that suppresses immune response. So you can see there's a little bit of a conflict there. So typically, I have not added the PCR testing on the blood panels because I felt like they weren't quite sensitive enough for the extra money involved for the patient. Now, different practitioners would say something completely different and may oppose me on that. That was just my kind of impression, my point of view. So then a couple of years ago, there was a lab called DNA Connections that came out with a urine PCR. And that was really compelling because there was no other blood draw required, and by the definition of a PCR test, if you find traces of the DNA of the bacteria in the sample, then that says that the bacteria is present. So a lot of doctors, I sort of sat on the sidelines for a while waiting for everyone else's sort of feedback. And then I thought, I'm just going to dive in and start ordering these tests. And I feel now in retrospect that there are times where that's a really, really good choice and times where it's a good choice to do the basic blood panel. What's happened since then is IGeneX has also come out with a urine PCR test. And so I have started running that test in some situations with my patients. I've always liked IGeneX and nothing negative about DNA Connections at all, but I've always trusted IGeneX. I've always gone with them. So when they came out with a similar panel, it's actually a bit less expensive. I trust them. So I've started running those. So here are the times where I think it's particularly useful to do the urine test. The first one I would say is if I'm starting to work with somebody and they say, look, I want the whole kit and caboodle. I want as much testing as possible. I want the most information possible. I don't care what it costs. And most people do care, but they've been sick for so long, they just want answers. They're willing to spend that little bit more. Then sometimes we'll do the blood panel and the urine panel. And, as a doctor, like the more information I get, the more I can help someone. Like the more accurate the diagnosis, the less ambiguous the test results, the more I can be like, okay, this is what we've got. This is what we're going to do. Let's go. The other time that I like the urine test is when I'm working with someone who's had an acute Lyme exposure, or acute episode of Lyme, meaning they were bitten by a tick. They knew that they were bitten. They knew they were, impacted by it. They may have had the bullseye rash. They may have got flu-like symptoms. So they just went for it. Did treatment first, ask questions later, which is my policy kind of on acute tick bites. I see less of them because I'm in Southern California, like mid-California, North California, we have a ton. I know other parts of the country and other parts of the world, there is a ton. Not quite there in San Diego yet, fortunately. But if I'm working with someone who is more acute, and they might say, look, I was here, I had a tick bite, I've got these symptoms, or I had the bullseye rash, then I will just go in with the antibiotics, and do detox support and the little naturopathic support stuff I do. But go in with the antibiotics and not worry about testing in the beginning, because if somebody's very newly infected, their antibodies are not going to be mounting a response yet. That can take weeks. And we don't want to lose weeks waiting for that. So I will typically treat with antibiotics, and then the urine PCR test is a great way to know or to feel confident that we've got it, that we've nailed it. And so in those kinds of situations, I typically do 6 to 8 weeks of antibiotics, even with acute, depending on, how many symptoms what manifested. But, at least 4 to 6 weeks. And then I'll follow up with the urine PCR. And if it's all clear, then I'll say, great, you're on your way, you're good. Maybe do some antimicrobial herbs for a couple of months. And if something comes back positive on that PCR, I know that our work's not done. Now, it sometimes gets confusing because somebody might have had a tick bite and an exposure and an infection, but that doesn't mean they weren't previously infected. But that's a whole other, rabbit hole. We can't always pinpoint that. The other time I think the urine test is really useful is when a patient is sort of in remission, feeling good and wanting to come off treatment. And our rule of thumb is treat 2 months beyond resolution of symptoms. So what I find is that PCR test is helpful in just seeing what's left over. And again, we know that in chronic Lyme, we don't say cure. We don't expect that any trace of the bacteria is gone forever. So sometimes things do still come out in the urine test, in the PCR test. But it may be more of an indeterminate. It may be what DNA Connections would call an NPS result, which is non-predictive size. They see some fragments of the DNA, but it's not like the full-blown result that they would consider like a strong positive. So in summary, when I start working with someone for someone's first Lyme testing, I highly recommend IGeneX. I highly recommend a blood panel for Lyme, tick-borne relapsing fever, which is just variant strains of Borrelia, and co-infections. I think that's super important. If somebody wants to go that extra, it's another $400. It's a urine sample to send into the lab. Get the PCR as well, just to be able to compare. Then great, the more information, the better. But the blood testing, in my view, with a new case of chronic Lyme, that doesn't really make sense. But for someone just, evaluating themselves for chronic Lyme, the blood testing is key. Where I think the urine testing comes in handy is more of the acute cases where we treat it aggressively and then want to make sure there's nothing left over that we didn't account for. And also people who have been chronic, they may not even be mounting an antibody response. So that blood antibody testing is not going to be so helpful. The Western blot, the IFA testing may not show up, but we may catch something on a urine test by PCR that we didn't catch on the blood. And if we're coming out of remission, or coming out of treatment, I should say, into remission, then we just want to make sure that nothing pops up as a co-infection that we haven't caught yet. Just, to see the residual and to see the levels. If I have someone who feels really good, but they still come back with several things positive on the urine test, then I will say, hey, you know what? Our work's not done. You may be feeling good. We may just stay with natural treatment. It may be ozone therapy. It may be high-dose vitamin C. It may be, I'm not saying more antibiotics necessarily. I'm just saying then it can be an indicator of what is left over that hasn't been adequately addressed. So I hope that clarifies and doesn't confuse. I know that Lyme testing has always been a very sort of tricky, ambiguous subject, but there are ways to maximize the information we get and to optimize the accuracy of it. And, you know, as I keep saying, the more testing, the better. But obviously, it's easy for us practitioners to say that we're not the ones paying for it. IGeneX does not bill insurance. They will bill Medicare, which if you have an MD ordering it, that's fine. I'm an ND, a naturopathic doctor, and Medicare doesn't actually recognize our lab requisitions, so that doesn't help my folks. We try to get their primary care or an MD to sign off on it so they can get that coverage. Some PPO insurance will reimburse after the fact, but I always tell my patients, just assume it's money spent. If you get anything back, that's a bonus, but you know, otherwise you won't be, don't count on it, is what I tell them. So there are some people who've come in to me with positive Western blots through LabCorp. And in that case, I may say, look, I don't need any more evidence of Lyme. That's fine. What you're positive on LabCorp is a positive to me, but we do need co-infection testing. And if they can't afford a whole, you know, $1,500 co-infection panel, sometimes we'll do the urine test for them too and just see what happens, right? So at least we're developing more options. I feel like some of our specialty labs are really working on trying to improve their testing, their methodologies, get it more accurate so that we can have more people sort of accurately assessed and then be able to treat some of these, you know, mystery illnesses, invisible illnesses that we know have an underlying cause and that just hasn't been found yet. So all the very, very best to you. I hope that was helpful, and I look forward to seeing you again really soon.